When your child needs therapy, you naturally try to find the best specialist who uses the best techniques, but there are hundreds of them. What if I tell you that most of them won't even benefit your child? Why? Because the kid may not be ready for conventional therapy. In this video, I'm going to share 4 questions you need to answer before spending thousands of dollars on talk therapy. I'm also going to talk about alternatives and share some resources. This is me, Dr. Ruben Gagarin. I'm your favorite child psychiatrist. Let's dive in. We'll start with a list of questions before unpacking them. 1. Can your child talk to a strange adult for at least 30 minutes? 2. Can they talk about their feelings? Can they identify their own emotions? 3. Have they developed abstract thinking that is required to benefit from psychotherapy? And 4. Do they have capacity to make these changes in their lives? To illustrate my point, I'll tell you about my recent patient. She's 10-year-old and she has been seeing a therapist for over 3 months. Her family spent over $2,000 on the sessions, but instead of getting better, she was getting worse and worse. She started seeing the therapist alone, then her mother joined in, they tried different approaches, but she was not improving, hence they refer her to me. I went down the list of my questions. 1, could she sit down and talk to me for any period of time? The answer was no. Within 5 minutes, she lost focus, became fidgety, and started moving around my office because she was bored. Number 2, could she identify and talk about her emotions? The answer was so-so. She could identify the major emotions like anger, joy, fear, but she could not identify any shades of emotions, and as a matter of fact, she couldn't really talk about her own negative emotions. She only could point out other people's feelings, but had difficulties identifying it within herself. Between the question 1 and question 2, her mother actually did most of talking. Number 3 is abstract thinking. That is the trickiest one. It is ability of a person to manipulate abstract concepts, to find patterns, change the concepts and apply them to a new situation. So obviously, one needs that to benefit from psychotherapy because they bring certain situations and feelings to their therapist and discuss them in abstract way, and then they should learn something from it, being able to morph it and adjust it to a new situation outside the office and apply them to their lives. How can you tell that your child already has developed this abstract thinking? You can, for example, tell them a story, something like Boys Cries Wolf, about the shepherd who was bored and crying wolf, so everyone came to him, but wolf was not there. But then the actual wolf came, he cried wolf, and nobody came. You can tell the story to your child and ask them, what does it actually mean about life? If they say, well, there was this stupid shepherd and they called the attention of others and then they couldn't get help when they need it, then they don't really have abstract thinking. If they tell you that it is about people's lying and lying is bad because it actually would not benefit even the person who is lying or something along these lines, then they using their abstract thinking. Another example is a movie or a book, something like Harry Potter. Do they see Harry Potter as a story about magic and adventure, or it is a story about relationships? Or maybe they should watch Inside Out. I have a video about Inside Out too. Do they see it as a story about cute characters who go through adventures, or it is a story about human emotions and how these emotions may be applicable to your child? The second one, obviously, an answer that illustrates abstract thinking. 4, does your kid have capacity to change? There are kind of 2 sides to this question. 1, do they actually care enough? Do they take responsibility? Do they see that their behavior or their emotions causing problems in their lives, something that they would like to change? And the second part of the same question, do they actually have ability to do that? For example, if they're extremely depressed and they don't enjoy life, they don't go play soccer or play with their friends, they feel so lonely and isolated, they may not be motivated to change. Then we need to address the depression first before addressing the rest of it. So obviously, one needs to answer yes to all 4 questions. They need to be able to talk to a therapist, to talk about their feelings and identify their emotions. They have to have abstract thinking and also care enough and be able to make changes in their lives. Otherwise, therapy just doesn't work. Sitting and talking to someone in the office does not work unless a person starts making changes outside the office. Patient who I mentioned also had undiagnosed ADHD. Because of that condition, she was actually feeling depressed. She could not fit in, she couldn't develop long-lasting relationships because she couldn't pay attention to conversations with her friends. She was underperforming academically. So obviously, psychotherapy is not going to fix all the ADHD problems. In fact, one needs to actually stay focused to benefit from psychotherapy. So she had to start with medication so she can benefit from psychotherapy. Now, what if the answers are no to these questions? If your child is not yet ready for conventional psychotherapy, there are three main alternatives: behavior therapy, play, and art therapies. Let's start with behavior therapy. For my patient who I mentioned, she started doing behavior therapy with one caveat that they were missing. The mother joined the sessions, they started working together, they developed a plan within the sessions, and then when she left, she tried to apply it outside and teach her child how to use the coping strategies. But the problem was she did not have a written plan. So like any other normal person, she did not remember every single detail that they discussed in the session. And moreover, a week later, when she returned to the follow-up session, she couldn't really remember exactly what worked and what didn't. Essential part of behavior therapy is a written plan. Written, so you can refer to it at home, then you bring to the next session, you can see what worked, what didn't, and then make changes. It will not be perfect. It doesn't have to be perfect, but you have to have a plan before you start changing the plan. If you never had a plan, there is nothing to change. Second is a play therapy. How does it work? Well, kids under 12 also capable of learning, but it takes very many more repetitions before their brain figures out the right pattern and start applying new learned coping strategies. Of course, you can wait for these opportunities at home to teach your child, but it may take very, very, very long time. Maybe by then they already turned 12 and gonna be ready for the regular therapy. Or you can sign up your child for a play therapy where therapists create different games, repeating the same patterns from different angles, so your child can learn how to cope with similar situations outside the office. Play therapy works very well for something like trauma. A lot of kids who have medical conditions, they may be admitted to a hospital for extended period of time, they get poked with the needles, the strangers talking to them, it may be uncomfortable, so the hospitalization may be very traumatizing to them, but yet they don't have capacity to talk about their feelings and emotions and make the changes consciously. So the play therapy with dolls that represent doctors and nurses and parents, etc., can help them to process this trauma so they can master it and put it behind them. A third therapy I'd like to mention is art therapy. It is very powerful. It's not only for kids. It is great for adults as well. It is fun. We can draw something or paint something, and most importantly, then we talk about our art. It forces us to recognize emotions that we may not be fully aware of. It also makes it more abstract. So we actually talk about these feelings in the session, separating ourselves from the rest of the world, and that gives us a little bit of break. So you may consider it for yourself. I understand that you're probably quite stressed. Here are some resources I'd like to mention to my patients. To find the right therapist, in US and Canada, I recommend to use psychologytoday.com website /CA for Canada. It is the largest therapists classified nationwide. You can type your zip postal code and find therapists in your area. You can read what they say about themselves, what techniques they use. Some of them use art therapy. Some of them may use play therapy. You can see their picture. You even can schedule a free meet and greet appointment so to see if they're a good fit for your family. As I implied before, the kids learn much more from their experiences than from the talking in the office. And who is there better to support them in their learning than you, their parent? However, we parents don't always know how to support our kids in every single situation if we had never encountered it before. What I suggest you can do is to get workbooks. There are very many. My favorite series out of what I had a chance to review is a series that starts with what to do when. what to do when you worry too much, what to do when your temper flares. The first, obviously, for anxiety. The second one is for anger management. And they have other books that may support shyness and obsessive compulsive disorder, etc. I find these books very engaging, they are age appropriate, they contain some instructions for parents how to use the books and how to support their kids at the age between 6 and 12. For the patient I mentioned before, we also went over some recommendations for sleep. She had difficulties falling asleep, so I suggested her to use guided imagery meditation appropriate for her age. I'm going to leave the link in the comments, but there are many available, and most of them are free. There are some paid resources, for example, calm.com. Disclosure, I'm not getting paid. This is just an app that I use for myself. I also recommended her to try magnesium glycinate. We can talk about magnesium in another video, but magnesium glycinate helps to calm nervous system down, relax the muscles, and may be helpful for sleep. This is it for today. Please leave a comment or a question to start a conversation. Thank you very much for watching. Subscribe to my channel. Come back for more. Bye-bye.